So, good morning, everyone. Now we'll see about the back. So, it is a surface landmark, and the eighth rib, the iliac crest, the scapula, the sacrum, the coccyx, and the spine, and all of it. So we have the superior nuchal lines and the external occipital protuberance. So the protuberance, it is a protrusion and a tuber present. So then we have the superior nuchal line. It is a nuchal line. So nu means a U-shaped one. So it's called nu. So these are U-shaped lines. So which are something like the lines of the Uganda. So they are invisible in certain regions, the borders. So then we have the lines of dissection. The vertebral prominence, the scapula, 8th rib, 12th rib, iliac crest, the sacrum, deltoid tuberosity, the acromion, external occipital protuberance. So clinically talking about it, these surface landmarks and the lines of dissection are not only very important for the dissection, but also these are the lines of importance of the clinically in humans, in animals, these are the lines of dissection, I mean the organisms, but in humans these are the lines of folds, which are the main reasons of disease causing. So it is that in certain cases, if a person is deceased, how he is deceased, it's because after a certain time of growth, the organs need to expel their negative energy. So the positive energy causes growth, the negative energy still remains in the body and circulations and are absorbed by these lymph nodes and these veins and all of these things. So if the negative energy is not met by the organs, the black organs, these parts of lines of dissection, they get folded, or they are deceased, or they anatomically modify to give way to the negative energy to get passed through. So there is a fault, there is a default. As the person develops from child to adult age, this lines of dissection take the shape of the earlier form. I mean, if you are an adult, if these lines are damaged, they take the earlier childish form. Or a developmental form, so that the disease is caused. So the skin and fascia of the back is given. So we have the cutaneous nerves, and so there is a diagram with the course and branch of typical thoracic nerve, and the diagram of with sympathetic ganglion, and we have the gray ramus communications. So to see the diagram how it is in the shape of so something like the road and path, this course of and branches of typical thoracic nerve. So then we have the muscle connecting the upper limb with the vertebral column. And so you see the next diagram, it is like from the brain, how is a circular portion of the nerve and the branches of it, the posterior root ganglion. So a bunch of this nerve co- like you mean like coagulation or a cognitive, like a shape of a oval shape, a round shape. So this is a ganglion. It is a meeting of the nerve fibers and a bunch of nerves like, and we have the sympathetic ganglion also, and the gray ramus communications. So, and this looks similar to a road path or something like that. And we have the muscular branches also. And so next we have the muscles connecting the upper limb with the vertebral column. So we have the trapezius muscle, and we have the ligamentum nuchae. So this nuchae, which previously we saw the superior nuchal lines, so we have the nuchae. So the nuchae and so there's a vegetable called nulkul. So this nulkul is used for this making this vegetable curry and all. So so it has a vast of the branches, different fibrous branches in it. So something like that. And we have the ligamentum nuchae. So you called as nuchae. And then we have the rhomboides major and triangle of the auscultation. So this auscultation is the place where we keep the stethoscope, and we auscultate by hearing the sound, and we keep 3 fingers and auscultate. So then we have, so this auscultation is like cult, means like a pig or a goat. So hearing, it has wide ears, so it's known as a cull. So and this auscultation is like the meaning of hearing. And next we have the dissection and all. And the superior nuchal line is also shown there. Then we have attachment of muscle connecting the upper limb to the vertebral column. Then we have additional features of the muscles of the back. We have the trapezium, and we have structures under cover of the trapezius, and muscles and vessels and all. We have nerve supplies and actions. So they have given the lumbar triangle and twisted tendons of latissimus dorsi. So these twisted tendons are present in each of the organisms. So this latissimus dorsi muscle actually gets twisted and get inserted. So it is of very strength and of an old form, maybe an old muscle, which is of origin. And so they are given the structures under the trapezius muscle also. They have given the spinal accessory nerve. An accessory nerve is like a nerve accessory to the main nerve, um, which assists the main nerve. And okay, we have the nerves and the bursae also. So they have given the transverse section also. We have the erector spinae muscle. So this erector is again the name of a demon god. Maybe a soldier also. So then we have the latissimus dorsi. So it is supplied by the thoracodorsal nerve. It is an extensor compartment, and we have so when its muscular slip is called as a dorsoepitrochlear brachii. So the other name is given, and so it is a honor name. And we have the triangle of auscultation, and so respiratory sounds heard through a stethoscope are said to be better heard over this triangle. So let's get deep into it. So the triangle of auscultation, because most of the people doesn't know to keep the stethoscope on the back, so they are very much confused about this triangle of auscultation, and we don't have it in the clinical medicine also. So this triangle of auscultation is a small triangular interval bounded medially by lateral border of the trapezius. So you see the trapezius, the trapezoid shaped muscle, a kite shaped muscle. You must just touch and see the back. So usually the trapezius is not very prominent in males. So about some 1,000 patients we have seen, this trapezius is not very prominent in males, normal males. In a fatty male, fat people, it is about somewhat palpable. And so then laterally by the medial border of the scapula. So the scapula also, the medial border is very prominent in males, but in females, due to the fat accumulation, and they have the breast also, like so this borders of scapula are not visible in the female, but in male these borders are easily visible. As of the trapezius is very much palpable in females, and the floor of the triangle is formed by 7th rib, 6th and 7th intercostal spaces. So the floor, the basement, so how to, so on the mid surface you must certainly note the trapezius, or you note the spine, so that if trapezius is not visible, so or not palpable, you just palpate the spine. Keep spine as a medial border, and to the lateral you will be finding the scapula. So even though women are fatty, scapula is somewhat palpable and prominently visible. And then we have the floor. So coming to the basement, you would see the 7th rib, 6th and 7th intercostal spaces, and the rhomboideus major. So you would see the 7th rib. So try the 7th rib, count the ribs, keep a note immediately back of the thorax, and the sixth and seventh intercostal spaces. So in between the 6 and 7, and you have the rhomboides major muscle. So this rhomboides major muscle is like a belly one. So immediately, if you keep the stethoscope in the rhomboides major, you will find it going inside all of a sudden. So that's where you palpate and auscultate. So this is the only part of the back which is not covered with muscle. So then we have the respiratory sounds heard through stethoscope, and are better heard over this triangle than elsewhere on the back. So on the left side, the cardiac orifice of the stomach lies deep to the triangle, and in days before X-rays were discovered, sounds of swallowed liquids was auscultated over this triangle. Okay, you find the cardiac orifice of the stomach also. So you could just diagnose the gastrointestinal problems also through the GIT sounds. So you hear not only the lung sounds, you also hear the gastrointestinal sounds. These both are very important for these uncurable diseases. So say like leprosy, HIV and tuberculosis, which take a longer time to cure. And then we have the lumbar triangle of the Petit. So there is a lumbar hernia also, and so they have given the dissection, and that's all. It has end. So in the diagram, have they given it? The triangle of auscultation. Yeah, I stated about the rhomboides major in the triangle of auscultation. They have given a lateral section. Okay, thank you. We'll see about the cutaneous nerves and superficial veins and lymphatic drainage of the upper limb.